Hi folks, it's Dr. Rob Cywes. I am the Carb Addiction Doc, and today we're going to discuss something that's been intriguing me for a little while, something that I'm very aware of. I see patients all day long, every day during the week, and they're all metabolic patients. The majority are metabolic patients, except my surgical patients. And if you consult with me, if you've ever consulted with me before, when you're a follow-up patient, I always lead off with this question. How have you been doing? What have you been doing? How have the holidays been? It's always an open-ended question for you to consider and give me a response to what's been happening with you since the last time we spoke. And what's very, very interesting, because what I'm trying to do is to gather where that patient is on a progression in their journey. And a large part of the consultation that I do with a patient, it's about talking, but it really is about understanding what a patient's personal perception is of where they are, what's happening to them. And then through the course of the discussion, helping them to change that perception based on my perspective as I see them. And controlling that narrative is so important, helping the patients to change their narrative as they see it. Because I am working vicariously through the person. I can't do anything. I can prescribe some medications, I can do some testing, but I can't do for you. Only you can do for yourself. But if I can help you to change that perception based on my perspective, that's really what we do. So, and those are the two words I want you to understand is this my perception? Or is this everybody's perspective of my life? And you want to be able to sit in that chair and have that bird's eye view of yourself, because so often we get trapped in our own perception and act on it, and it may be erroneous. So what are the three answers I get? How are you doing? Well, there's three responses I get. The first response is where somebody vomits out all the shit in their lives. Oh, well, this person died and that person poked me in the eye and I lost my job and we went on a vacay. And they tell me about all the stresses and all the negative issues in their lives. And the interesting thing is all of that negativity is really a pretext. And they're telling me what's going on in their own heads because they're telling me what their perception of their life is, which direction their life is pointing. And as such, that perception of all these horrible things happening, that anxiety, that flooding, that stress, is really a very impactful, powerful, emotional way of telling me without telling me that they've gone back to the fridge in the pantry for emotional restitution. We know that when anybody is dealing at the top of their head with all their stress and everything that's coming at them, they've allowed their brains to go back to an old way of coping. They've probably gained some weight, their blood sugars are up, their blood pressures are up. They've gone back to the fridge and the pantry and they are hitting the carbohydrates and the snacks and the binge eating. And I'm going to meet them there and help them to recognize that, because their perception is that there's nothing they can do differently. That they're trapped in this, that people came to visit and they were eating all this stuff and I had to. I went out to a Christmas dinner, there was nothing to eat, I had to eat the Christmas cake. That's their perception. And we're going to start at the beginning and help them to understand that that perception is a very sophisticated way of condoning a relapse in their addiction. Yeah, but you don't understand. And you know what? If they want to control the narrative from there, they're not at a contemplative place where I can help them. Because what fathead does, and that's what I call that blah, 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 blah. I call it fathead. Fathead is where whatever good idea I give them, they've got 10 valid reasons why it's a bad idea. And that roadblocking and that obstinate fathead cannot be overcome by me. I can raise an awareness. But ultimately, they're going to stay trapped in that anxiety-provoked, anxiety-displayed depression, anger, frustration. They're going to stay in that and keep justifying doing drugs. I personally am obesogenic. In other words, if I walk past the donut, I'm going to gain 5 pounds. Weight gain is the way my body protects me from sugar. So one of the things I've changed apart from being on a ketogenic diet, because I hate to use this word, but calories are an issue, I like to suppress or reduce caloric consumption. And as such, I have created Mondays as no calorie Mondays. But as you know, you never want to white knuckle your way through a fast, to a 48-hour fast. So there are times when it's easy and it's straightforward. There are times when I'm really dragging, particularly if I'm not in ketosis where I'm exhausted. That's when I'll use a Ketone IQ. Ketone IQ, Cheryl and myself have found, is the best formula to rapidly promote a ketogenic bloodstream. Where I've got ketones in my blood work, not a big spike, but a gradual rise that lasts about 5 hours. And I may use this in the morning of that fasting, although I'll often use my coffee, but the time I most struggle is in the evening. When I'm about to have dinner, but I don't want to have dinner, and I'll hit one of these guys, it'll help me to cross to the next day. If I'm in ketosis the next day, I'm good to go. May use one again the next morning, but I strongly support Ketone IQ to help you through your fasting. Even if you're trying to go from 2MAD to OMAD, 2 meals a day to 1 meal a day, and you're struggling at lunchtime, pop one of these babies in. Make sure you chase it with some coffee or some tea, but it'll help you to transition that time where you ordinarily would eat. The second response I get, usually from early on from my patients, is we're in a very excited, very animated way. Oh yes, I've changed this. I'm not snacking. I'm gone carnivore. They tell me about all the good things that they're eating and drinking. Or I went to Thanksgiving and I just had one little piece of cake. I didn't eat the pasta. I didn't eat the... And they approach it completely from a what they're eating perspective, a what, which is diet. And that is a rite of transition. We have to go through the dietary side in order to correct the addiction. Because addiction is a change, managing carbohydrate addiction is in a small piece a change in our diet. But that's a tiny fraction of what we're doing. Because carbohydrate addiction isn't about nutrition, it's about emotion management. But there is a nutritional call to action. And if that's all you do, then all you're doing is staying on a diet, changing what you're eating. But yes, they're animated by what they're eating. And I love that, and I've got to support that, and I've got to embrace that and continue that. But the only way to make that sustainable is to simultaneously, as replacing carbohydrates in their diet with real food, simultaneously replace instant gratification with an effort-based emotion management system. And we start there, and we talk about some of those additional things they can do. And then the third perception of people's lives is, for me, the Holy Grail, where they are telling me about all the fun things they're doing and planning to do. I'm planning on running a 5K now. I'm learning to play the guitar. I've joined a group. I've done this. And they're telling me about the life they're living. They're telling me about the effort they're putting into self-care and how good they feel about it and how proud of themselves they are. And it's the little achievements. I've taken up photography, and this year I made all my Christmas cards, my own photographs, and they're beautiful, and I had them printed and everybody loved them, or whatever that may be. I've gone back to church and I've developed a spiritual relationship, or I've started investing in Buddhism. I don't care. But they tell me about the life they're living. And I know that if that's what they're doing, then for the most part, the routine of their eating and drinking has shifted back to a nutritional format. We explore that a little bit, but for the most part, I know that their routines are new. And at first, early on, you've got to be in that second phase where you're heavily, concretely focused on changing what you're eating and the pattern by which you're eating, because you're making a change to the foundation of your eating behavior, and it's got to be a conscious effect. And that is the perception you live in. But slowly over time, that routine, and that's why we stress the routine, 2 meals a day, trying to eat mostly at home, having some of the structural elements. Once that becomes a daily routine, then all you want to do is to be vigilant about moments where you potentially can screw up. You don't have to be vigilant about the routine, because the routine is the routine. It's an established routine. Now you can start exploring self-care, and you want to juxtapose self-care against work. And if all you're doing is working all the time, where the hell's the self-care? Where's the oxygen that you're breathing? So those are 3 places where I hear someone's perception at the beginning where they currently are. And my job is to give them my perspective on what they're telling me, no matter which category they're in, to enhance moving forward. And one of the greatest perspectives I can give you is that carbohydrate addiction has nothing to do with nutrition. It's a dysfunctional form of anxiolysis. It's an anxiety emotion management tool that harms you. It isn't about food. It isn't about nutrition. Yes, it involves food. Yes, it involves nutrition, but it's not about nutrition. It's about stuff above your eyebrows. And changing that perception and changing that perspective, the next discussion is going to be about anorexia. And that, for me, folks, is one of the most difficult patient populations to treat because their perception is so distorted that this is a problem with their bodies rather than a mental health issue. There's no ownership of the fact that this is a mental health game. And it's so difficult to turn that perception around by giving them my perspective because they don't trust anybody. It is an anxiety based upon an absence of trust of anybody, including and most importantly themselves. And we'll talk about that in the next segment. But understand your perception and try to step back from your perception to gain other people's perspective. And then take that perspective, because you won't own it right away. It may sting a little bit, but take that perspective for a walk and mull it over, process it, and see if it resonates with you. How can I do this? Rather than, for these valid reasons, I'm not going to. I am the Carb Addiction Doc. Till next time.